Rare Disease Day falls on February 28 and highlights a crucial issue affecting an estimated 300 million people globally. With over 7,000 rare diseases, low prevalence and limited medical expertise lead to issues such as delayed diagnosis and treatment accessibility. These challenges isolate patients and emphasize the urgent need for support and intervention. At this crucial moment, we engage with an expert dedicated to empowering those affected by rare diseases, as well as contributing to efforts raising public awareness. Nice to meet you.
Hi, good morning. Very nice to meet you.
Jingli from China Daily.
I'm Nicolas from Servier.
Can you tell us a bit about your position?
So I'm the Chief Patient Officer, and as Chief Patient Officer, I make sure that patient engagement and patient centricity remain a priority and a focus across the whole group.
As the Chief Patient Officer, how would you describe your role in a pharmaceutical company?
That's a great question. Our ambition is to champion patient engagement and patient centricity globally. I have the privilege of leading the Global Patient Affairs team, where we make this vision a reality. I make sure that patient engagement remains consistent, coherent, focused, and well coordinated across the whole group and all the countries. So it's a little bit like directing an orchestra, if you like music.
I noticed that your educational background is related to clinical and scientific career paths. So what makes you shift your focus?
When I was 15, I was treated for a pediatric cancer. And that set me on a course, on a path towards where I am today. At first, I gravitated towards science because I wanted to gain a deep understanding of the mechanisms of diseases, and in particular of cancers and rare cancers. And then more and more, I wanted to work closer with patients, and I became a pharma professional.
Talking about the awareness, we know that the Rare Disease Day is coming up very soon. So how do you view the challenges they are facing?
Patients with rare cancers face very similar challenges, and some of those challenges are lack of fast and accurate diagnosis, lack of treatment, and lack of good access to those treatments. They're usually recognized as underserved populations, and so we really need to pay particular attention to their specific needs.
So how do you see the gaps between the patient's needs and the available treatments?
There are many gaps, and that's why pharmaceutical companies and healthcare professionals, decision makers, and patient associations need to work together, because in the end of the day, we all want the same things. Patients tell us that they want faster treatment, better access, more research, more clinical trials.
I did a little research and I found that they have their own patient organizations to work together. So in your opinion, how can the pharmaceutical company, medical institutions, patient organizations, and the society as a whole to work better to help empower the patient?
In recent years, we realized that now patients want and need to be empowered, have access to information, and to be really involved at every step of the healthcare ecosystem as decision makers and as stakeholders. And so that's why we all need to work hand in hand with patients.
In the future, what breakthroughs do you hope to see? And what is Servier working to achieve those breakthroughs?
We're really hoping to bring more innovative treatments to China for patients suffering from glioma and other types of rare and hard to treat cancers. And right now we are running clinical trials in China as well as real world to make sure that we have all the data required to achieve that goal.
So suppose that if I found myself have a rare disease, what should I do?
First of all, obviously, the relationship between a patient and their doctor is really sacred. We want patients and doctors to really work together for shared decision making and personalized medicine. I would say the second thing is to get in touch with a patient association, because patient associations, they can provide a peer-to-peer support. They can provide sometimes tools and educational information. So that's really important for patient associations to create very tight bonds. within a rare disease community.
In China, we have an old saying that is, if you are suffering from kind of illness, you are the doctor of this field.
They are stakeholders, decision makers, and the ultimate voice that everybody needs to listen to. And so it is widely recognized that patients are the ultimate experts in their conditions because they have unique insights. Not only that, but they also understand the impact of their disease on all the aspects of their lives, but also all the aspects of their families. So we absolutely need to work with them.
If you could give one message to those people suffering from the illness, so what would it be?
Well, I want to give them hope. Theme of this year was united by unique. And I think that's a powerful phrase because I don't want patients with a rare cancers to feel alone. Everybody is unique, but together we're all stronger. So I really encourage rare cancer patient communities to come together as patient associations, as coalitions, as consortiums to elevate their needs and their preferences. That is the goal that we have in common. And we work towards that everywhere, every day, everyone.
If you could say one sentence to all those patients to the camera, what would it be?
We are working all day, every day, very hard to bring new therapies, new innovations to China and the rest of the world. So I want to thank you for your partnership and for your trust.